Hello, I'm Andy Mangione with AMAC, the Association of Mature American Citizens. AMAC is a member benefits and advocacy organization guided by faith, family, and freedom. We are proud to represent the conservative values of our membership that numbers 1.6 million nationwide. Now, it's no secret to our audience that Americans, especially the middle class, are getting hurt by healthcare costs. Since the 1970s, healthcare costs have increased fourfold. But you may not know that this is in large part because of hospital costs, which have increased 10 times, and the cost of drugs, which have increased, wait for it, a shocking 133 times since the 1970s. Our purpose of today's discussion is to make clear the main reason why hospital and drug costs have risen so sharply, tell you about a very simple solution and what you can do about it. We want you to understand that there is one simple bill that is already written and just needs to be introduced. It'll save $200 billion per year in American healthcare costs without mandated rationing or escalation of copays and deductions. Let me introduce to you our panel of experts to discuss this. Pastor Stephen Broden. He's the senior pastor at Fair Park Bible Fellowship in Dallas, Texas, and a member of the National Black Healthcare Coalition. Dr. Robert Campbell is president of Central Pennsylvania Anesthesia and chairman and co-founder of Physicians Against Drug Shortages. And Dr. Marion Mass, a Philadelphia area pediatrician and co-founder of a physician advocacy group called Practicing Physicians of America, which is connected to thousands of physicians from all specialties across the country. Pastor Broden, Dr. Campbell, and Dr. Mass all agree that healthcare will never be affordable unless we repeal the safe harbor for pharmaceutical, hospital, and pharmacy middlemen. Americans are paying more, yet are receiving less in terms of health care. Pastor Broden, are you seeing the pain of high cost and problems accessing care in your congregation and in congregations of your colleagues across the country?
No question about it. The high cost of health care and medicine is having an adverse impact on poor people across America. Folk in my congregation, like many across America, are being devastated by skyrocketing costs. It seems as if there's a deliberate attempt to force Americans to depend upon the federal government to purchase its medicine. This is socialism. Vladimir Lenin said that socialism is the keystone to the arc of the socialist state. And it seems as if we're moving towards socialized medicine in America, and we don't want that.
That's heartbreaking. Dr. Mass, is it possible that there are people profiting from all these high costs that we are unaware of?
It's not just possible, Andy. It's the reality. Americans intrinsically understand if they're paying more and getting less, someone must be making out like a bandit. Where is all that money going? And what Americans need to learn is what we're here today to tell you. That there are middlemen within the pharmaceutical and hospital world. These middlemen companies have higher revenues than the pharmaceutical companies themselves. This is America's dirty little healthcare secret. We'd like to introduce you to who these industries are. Group purchasing organizations, GPOs, and pharmacy benefit managers, PBMs, are the two industries we're here today to discuss. Group purchasing organizations control the hospital supply chain. That means when you walk into a hospital, everything you see, including the drugs, the solutions, and the devices, is brought into that hospital via control of the group purchasing organizations. Pharmacy benefit managers control the prescription supply line. Americans are more familiar with these companies: CVS Caremark, Express Scripts, or Optum Rx. Now, this $200 billion per year that you could be saving, you should know it's flowing into the pockets and the revenue coffers of the group purchasing organizations and the PBMs. And these companies do not do any manufacturing. They don't do any research and development. They don't even ship the drugs around. They simply write the contracts that allow everyone else except your physician to decide which medication and which solution that your insurance company is going to pay for or is going to be available in your hospital. Physicians don't like this because We know what you medically need.
Worse yet, Andy, these industries asked for and were granted immunity from prosecution for taking kickbacks. One would expect that since they asked for this immunity, they have very good reasons for it. It's not in the interest of the patients. It's because these contracts make people very rich. It's the very reason we have racketeering laws. Pay-to-play contracts just simply allocate market share to companies in exchange for payments. Patients end up paying more for lower quality health care. So unique to these secretive contracts is the permission to write secret kickback contracts to allocate market share for medications and critical supplies. At times, for the right fee, one can actually get a sole source contract where you are the only company permitted to make a medication. In that case, price is no object, the sky's the limit. This is by design driven the cost of healthcare and the cost of medications right through the roof.
This is truly shocking.
Over time, the GPOs and the PBMs have consolidated. So there's now a big four group purchasing organization that controls 90% of the supplies that go to all hospitals and nursing homes. There's a big three pharmacy benefit manager cartel, which controls 80 to 90% of all the prescription medications that we access at the pharmacy.
And isn't it shocking that like 7 companies that are controlling the whole prescription and hospital supply chain have the right to receive legalized kickbacks? Wow.
The strangest thing, Dr. Matz, is that these are in essence, they are middlemen, but they're an extra layer of middlemen. They don't really touch the product. They have nothing to do with trucking or distribution. They simply write the contracts, collect the kickbacks. President Trump probably said it best in his Rose Garden speech. He introduced his blueprint to lower drug prices. We are very much eliminating the middlemen. The middlemen became very, very rich, right? Whoever these middlemen are, and a lot of people have never even figured it out, but they're very rich. They won't be so rich anymore. In my estimation, and I've been in practice for 30 years, and I've seen this condition emerge into the delivery of health care, and I've seen it more lately taking over health care. It is the most important factor for lowering health care costs by a wide margin. This simple law, making kickbacks illegal, will change the cost of health care in ways that would be so dramatic, it would be even unbelievable. Of course, the problem is that President Trump does not have the power to fix everything. He thought he might, and he wanted to try, but he doesn't have that power. He's done as much as he can by writing a rule to reduce and eliminate kickbacks. But even President Trump admits that the Congress has the authority to end this. They need to pass a law to make kickbacks illegal again in healthcare. Now, why would they perhaps be reticent to do this? Members of Congress, it turns out, receive a lot of campaign funds from these middlemen.
Always money, isn't it?
And the public has very little awareness of who these middlemen are. Unless and until the public finds out who these people are and demands accountability, this won't change. Congress needs to fix this. If you demand it, they will be forced to do it. And you will be proud to say that you have stopped the entire industry from robbing the sick to give to the rich. This has to end, Pastor Broden.
You know, it's patients with chronic diseases and pre-existing condition that are most hurt by these prices. They tend to be those patients who need medication and require hospitalization. For example, the African-American community suffers most from kidney diseases. The number one cause of kidney disease is diabetes. The number two cause is high blood pressure and hypertension. These diseases are the diseases that require medication, and the medication cost for those two diseases is through the roof.
How is it possible that in 2019, a small group of companies literally control healthcare supply chains and can receive or have the legal right to receive kickbacks?
Andy, in 1987, Congress passed the Medicare Patient Protection Act. The title of this law suggests that it's a very good law, and it is. But often in Washington, small laws are added on to larger laws, and these are added on without real scrutiny. And this is exactly how the safe harbor protection for group purchasing organizations and pharmacy benefit managers came into being. The name sounds comforting, a safe harbor, but patients and doctors know instinctively that this is a very unsafe safe harbor.
An avarice that fleeces Americans.
Unbelievable. Our own government did this to us. And today, they call these kickbacks rebates. You're not getting any of that rebate money. It's going to those middlemen.
So let me get this straight. Big group purchasing organizations and pharmacy benefit manager corporations who decide which brand name drugs get covered by insurance and decide which supplies get to hospitals take money from suppliers? How is this not a conflict of interest? Could it influence which drugs and suppliers doctors choose for their patients?
Bingo. And I think the public can understand this. How could it not influence what they choose? Keep in mind, as Dr. Mass points out, these companies do no research, they do no manufacturing, they have no trucks, they do nothing except write secret contracts and collect the fees.
Because laws have unintended consequences. Several years after the safe harbors were passed, doctors began noticing shortages of critical medications and solutions. We are MacGyvering our way around having to protect our patients from dangerous drug shortages across our country. Since 2006, the FDA has been tracking the shortages of over 300 drugs and solutions. And most of these things are critical medications like saline, which is salt water. This has been studied again and again in Senate panels. These shortages, it has been proven time and time again that the root cause of the shortages is the safe harbor for kickbacks for GPOs and PBMs.
Dr. Campbell, what kinds of drugs are in shortages?
Well, the biggest category is chemotherapy drugs.
Oh, Bob, I've spoken to many oncologists from around the country who tell me that they're having to choose which of their patients is getting a certain chemotherapeutic because they're rationing it. A few weeks ago, I spoke to an oncologist who told me that they had one patient who had testicular cancer, a 22-year-old man. They had another young woman, 18, with lymphoma, and they had to choose which of their patient is going to get the chemotherapeutic for the day. That's tragic.
That's heartbreaking, Dr. Mass.
Sure is.
I can tell you it's a big deal in my field of practice, which is anesthesia as well. We're basically missing a lot of the anesthetic medications that we use to treat patients. The public is not aware of this. These shortages have been present in my career since 2006, and they've not eased up one bit. There are times where I must administer a general anesthetic to a patient, even though I know a local anesthetic would be the superior way to care for that patient. And the only reason I have to do it is because it's the only thing I have. I don't have the medications that I need.
That's unsafe and expensive.
And it presents a dilemma. Now, I can tell you that in my practice, we have women who are coming in labor who are experiencing complications during pregnancy. There is a whole array of medications that we use for obstetric complications that we simply have to ration. So, for instance, if there's a woman who comes in pregnant and is seizing, they would get a medication. If a woman comes in and just simply has out of control high blood pressure or deterioration of their kidney function, they would not be given that medication. We are rationing life-saving medications at the altar of a supply chain which has become corrupt. The emergency room is the exact same situation. There are many very simple generic medications, epinephrine, Narcan, sodium bicarbonate, which would be baking soda, where we are literally using the medications in a very, very discreet way for the sickest of sick patients. And people who would otherwise have gotten the medication because they really need it, we're rationing it and not providing that medication.
You know, I don't want to get dramatic, but are we in Soviet Russia? Are we in a third world country that rations medications? I thought generic drugs were cheap and plentiful.
Well, Andy, generic medications should be very inexpensive. It's the way our system is set up. But the structure of the supply chain has hijacked that, frankly. And when you only permit one company to make an emergency medication like epinephrine, it doesn't matter if that medication goes from $5 a dose to $1,000 a dose and it's in short supply. It's the way the incentives are embedded in the supply chain. And it's pay to play, and it's not benefiting patients. So Dr. Mass mentioned the drug shortage list. And as long as we've had these lists, there's been an interesting characteristic of the list. 90% of the medications on the short supply list have one and only one manufacturer. There's a reason for that. We need to have an open market with competitors. We need to restore integrity to the pharmaceutical supply chain. The only way to get it done is for you to be aware and to tell your congressman this has to change. We talked about the emergency room, salt water, saline, we call it in healthcare. We're rationing saline. Now, this is the most abundant substance on planet Earth. Yet in hospitals, you can't get it.
And this is why insulin is so expensive?
You bet, Pastor Broden. There are 3 companies that are allowed to make insulin. A study from the Berkeley Research Group determined that of the $400 per month that a typical patient pays for their insulin, $300 of that goes to fund the kickbacks. This is really why we have anti-kickback laws, because in the end, the consumer always pays the cost. And with a medication like insulin, we just can't afford 75% of the cost of insulin to be kickbacks because these people have no choice. They need their insulin. Now, more recent revelations have demonstrated as the cost of insulin has risen to $600 and $700 per month, that 70 to 75% kickback rate is still in place. We need to get rid of that.
Sounds to me like the patients can afford the insulin. They just can't afford the kickbacks.
This is outlandish. This is hurting people across America, and most especially African Americans who have a higher rate of diabetes.
You are spot on, Pastor Broden. But your congregation also has higher rates of maternal and infant deaths, and this is related to the kickbacks as well.
Tell us how, Dr. Mass.
Well, it's well known that African American mothers have higher rates of premature births, higher rates of hypertension in pregnancy, and that there's a higher infant mortality rate, which is driven by babies being born prematurely. Now, Dr. Campbell brought up how when mothers come in to the hospital with complications from labor, that we're missing all kinds of medications. One of my colleagues is an obstetrician in the Washington, D.C. area, right in the backyard of all these congressmen and senators who are doing nothing about kickbacks. And she tells me that in comes a woman who has very high blood pressure and is at risk for having a seizure. Well, she's missing the medication, magnesium, a simple salt, that she needs to give that woman to protect her from having the seizure. And if her hypertension gets bad enough, she really should put the woman into early labor to deliver to preserve the life of the mother. But guess what else she's missing? She's missing Pitocin, the drug we use to help that mother go into labor. Now this woman needs to be put under anesthesia and finish it off, Dr.
That's the thing,
Campbell.
Pastor Broden, is these complications very often lead to emergency cesarean sections. The safest approach for these women, for the care of these women, for their surgery, is spinal anesthesia or epidural anesthesia. But we don't have those medications. So we're forced to do general anesthesia, which puts everyone at greater risk.
And I'll tell you, as a pediatrician, not only is it not safe for the mother, it's not safe for the baby. And in many of these cases, because these women came in with premature labor, what you have resulted in is a fragile, premature infant. And when those infants are taken care of subsequently, they often have need to have their nutrition come through their IV. You need specialized solutions to have this, solutions such as calcium and magnesium. Well, they're in shortage. And God forbid these poor babies have an event where their heart stops, because we're also short of the epinephrine that we need to restart their hearts and save their lives.
This is unacceptable, and it needs to be fixed yesterday. This is hurting people, hurting families, hurting women, and hurting children, and most especially those who are in the poor neighborhoods like mine. We need to have solutions right now.
And let me say this again, because the pharmaceutical manufacturers are not angels, but these profits are going to these extra middlemen companies that have been inserted into the supply chain. They make no product, they do no research. We need to address this issue first and foremost. And we're here to let you know who they are and what needs to be done.
The American people have been fooled long enough by fat cat middlemen and profiteering established politicians. Enough, right?
Enough is enough.
This has been eye-opening, shocking, really. But what can everyday citizens do about this?
Well, they can start by having conversations about it. You know, I've been in healthcare reform for 5 years, and I didn't know about this at all until Dr. Campbell alerted me to this issue. So start having conversations about this with your friends and your neighbors. You could share this video.
Yeah, one place to start is to go to the nomiddlemen.org website. You can learn more. You can see the video and share the video with everyone that you know, your family, your friends. We have a petition on change.org, which is endorsing the removal of these kickbacks.
The time for action is now. You can talk to your pastors, to the clergymen, to community activists. We need to stop this mendacious, evil practice and bring this back into line, and you can help.
What else can we do?
You can call your congressperson and both senators and ask them to start acting like the public servants that they swore they would be, and to repeal kickbacks for middlemen. Better yet, why don't you get a group of citizens that are concerned to go into their offices? They love to have citizens come in and talk to them about issues.
The evidence is very clear. Americans can afford health care and medications. The thing they can no longer afford are these secretive middlemen kickbacks. You have to ask your congressmen and your senators, are you in favor of these healthcare kickbacks that make prescription drugs unaffordable and have made hospital costs soar? Or are you against these kickbacks?
Will you stand for patients or will you stand for profits?
We need to make healthcare kickbacks illegal again.
There's no question about it. We're being forced to depend upon the government for our health care and for medicine. This is moving us rapidly away from the founding principles of this nation and a free market. We're moving towards socialized medicine. That would be very dangerous for America and for its citizens. We need your help.
Please view and share this video and the accompanying talking points at the AMAC website. www.amac, that's AMAC.us. There you'll find talking points and resources under Advocacy in the menu dropdown. Share it with your relatives, friends, neighbors, the people you go to church with, and importantly, your member of Congress. AMAC can provide you with additional training so you can speak with your congressmen, senators, and other organizations. You can contact Jan Morrow, National Chapter Director, at 352-353-3355. This has truly been both educational and sobering for me and our audience. I'd like to thank our panel for their time.
Our pleasure.
Thank you.